Whether you start your day in fluffy slippers or well-worn work boots, today your feet are going to take you many places. In fact, over your lifetime, your feet have taken enough steps to take you all the way from one coast to the other and back again, perhaps with a few scenic stops along the way. And over all those steps, you probably have not given your feet or skin much thought. But when you have diabetes, you need to pay special attention to your skin and feet each day.
I've seen pictures on how people lost their toes. So that was a wake-up call for me when I realized that what diabetes can do.
Diabetes can take a toll on your overall health, including the health of your skin and feet. When you have diabetes, blood glucose, a form of sugar, builds up in the bloodstream. Over time, high blood glucose can cause long-term health problems like neuropathy, also called nerve damage, and poor circulation, both directly affecting the health of your skin and feet. Your nerves allow you to move and feel. Damage to your nerves may cause tingling, pain, burning, numbness, reduced sweating, reduced feeling, and muscle weakness in your feet and legs. Over time, this muscle weakness makes you walk differently, which can cause the shape of your foot to change and eventually cause damage like calluses, bunions, and hammer toes. Poor circulation means the blood flow to your legs and feet is reduced, most likely because of plaque buildup inside your vessels. Poor circulation can cause pain, cramping, and less hair growth. Your legs and feet can also look bluish. If you get a cut or sore, poor circulation can slow healing. Together, neuropathy and poor circulation increase the chances that a small injury like a cut, sore, or blister will become a serious health problem. Neuropathy may cause your skin to dry and crack. Poor circulation slows healing, increasing your risk of infection. You may not notice even a small wound, and if it is not treated properly, it can lead to gangrene and eventually amputation of a toe, foot, or leg. But there is good news. By keeping your blood glucose in a healthy range, you can prevent or delay neuropathy and poor circulation, and as a result, prevent skin and foot problems. You can reach healthy blood glucose control by making healthy food choices, getting physical activity, checking your blood glucose on a regular basis, and taking medications if necessary. Work with your diabetes care team to reach your blood glucose goals in order to protect your skin and feet. With each step you take, your body weight is supported by different parts of your feet, creating pressure points. Normally, these pressure points are in your heel, the ball of your foot right below the toes, and your big toe. However, our feet change over time. The way we walk, our weight, weak muscles, the types of shoes we wear, and our health may cause our feet to adapt to the demands we put on them. To protect your feet, choose footwear that allows for these changes.
You don't want shoes that are very flimsy and can be folded in half. They don't have any support in them for you.
Select a shoe that supports your entire foot, is wide enough to relieve pressure, and gives your foot plenty of room. Leather and athletic shoes are good choices. Choose a shoe that has a heel of 1 to 1.5 inches or lower, a soft, absorbent liner, a toe box that extends a 1/2 inch beyond the end of your toes, and a heel compartment snug enough to prevent rubbing. Cushioned inserts designed specifically for your foot shape can help as well. Buy your shoes in the afternoon to ensure a proper fit. Feet swell during the day, so if you buy shoes in the morning, by evening they may be too tight. Have your feet measured each time you buy new shoes, and always try on both shoes before you make a purchase. Break in new shoes gradually to avoid blisters. If you have trouble finding shoes that are comfortable and protect your feet, ask your diabetes care team for help. You may need to see a podiatrist, a foot and ankle specialist, who can prescribe a specific shoe for you, especially if you have hammer toes, bunions, corns, or are flat-footed. Or your podiatrist may prescribe a visit to a podorthist, a footwear specialist, who can select or create a shoe specifically to fit the shape of your foot.
And what they do is they pour plaster inside of it, make a mold of your feet, and then they build the shoe around your foot.
Check with your insurance company. Some footwear may be covered by your plan. When selecting proper footwear, don't forget about your socks. Socks play an important role in protecting your feet. Wear a fresh pair of properly fitting socks every day. Choose ones that keep their shape, absorb and draw moisture away from your skin. Some labels may say wick, and don't have tight-fitting elastic bands or seams inside. White or light-colored socks are good choices because they allow you to quickly see any blood or fluid from skin damage. Wear appropriate footwear in every situation. Do not go barefoot or in socks even inside your house. Slippers may be appropriate at times, but they too should cover and protect your entire foot. In public showers, always wear shower shoes. And at the pool or the beach, wear water shoes. Protecting your feet each day and in every situation will help prevent damage. Remember, even a small cut, scrape, or blister can turn into a serious complication and put your health at risk.
Now I just be more careful of what I put on my feet to protect my feet.
Your skin is the largest organ in your body and your main defense against infection. But to do its job, your skin needs to be healthy. While you work to protect your feet and overall health, it is important you also protect your skin. When you have diabetes, high blood glucose can cause your skin to dry and crack, making you more at risk for infection. People with diabetes may also be at higher risk for rashes, boils, and the growth of some bacteria and fungi. To prevent breaks in your skin and infection, keep your blood glucose in a healthy range. Make healthy food choices and drink plenty of fluids to keep your skin hydrated from the inside. Keep your skin clean and always protect it from damage. When showering or bathing, check the water with your elbow before getting in to make sure it's not hot enough to burn you. Nerve damage in your feet due to neuropathy may not allow you to feel very hot water. Use a mild soap with warm, not hot water and pat your skin dry with a towel. Do not rub it. Every day, moisturize with a lotion or cream that doesn't contain alcohol, because alcohol tends to take moisture away from the skin.
You just need to moisturize your skin from top to bottom. Make sure your skin don't be dry and brittle, because it can cause cracks and sores and become infected.
Do not put the lotion between your toes. This warm, moist area is a nice place for bacteria to grow and usually does not need the extra moisture anyway. The best time to apply moisturizer is right after your bath or shower. This way, your lotion can lock in the moisture your body has already absorbed. and making it part of your daily routine will help you remember to use the lotion. Protect your skin from damage like sunburn.
Some people are good at wine, some people are good with cars. I got sunscreen.
Always wear appropriate sunscreen, clothing with built-in SPF, and find a place in the shade. And don't forget to apply the sunscreen to your feet. They can burn too.
It does have an expiration date, so it's important to buy fresh. And why not?
Use insect repellent when needed. If you do get an insect bite, try not to scratch it. There are several products available that can take the itch out of your bite and protect your skin. Together, these steps can help keep your skin healthy and able to protect you from infection. Over all the miles you travel, skin and foot problems can develop without you even realizing it. You may not be able to feel a stone in the bottom of your shoe, when you've stepped on a piece of glass while going barefoot, or gotten a splinter on the bottom of your foot. You may not notice an injury or infection right away, so take time each day to monitor your skin and feet.
I use a mirror to look at the bottom of my feet to make sure I don't have any sores or cuts on the bottom of my feet daily.
Check all the areas of your feet, including the bottoms, heels, and between your toes. If you can't easily see your entire foot, ask someone else to check for you. Make these checks a regular part of your daily routine so they become habit. It only takes a minute.
It's very quick to do the check your feet in the morning to dry them thoroughly after showering. It doesn't take long to do those things.
If you notice redness, flaking, warmth, calluses, dry or cracked skin, cuts or sores that won't heal no matter how small, a change in the shape of your foot, tingling, pain, an ingrown toenail, contact your healthcare provider immediately. Remember to check the inside of your shoes each time you put them on. Even a tiny pebble can cause damage. Preventing any injury is key. However, if you do develop an injury, getting treatment before it becomes a serious complication is very important. Do not try to treat any skin or foot problems yourself. That includes using over-the-counter products for corns, calluses, or ingrown toenails. These products may only make the problems worse. Instead, see your healthcare provider right away. Early detection and treatment can help you avoid any serious effects. To reduce the risk of developing an ingrown toenail or having a jagged nail that can cut your skin, keep your toenails trimmed. Use the shape of your toe as a guide. Smooth any rough edges with an emery board. If you have difficulty seeing your toes, reaching them, or keeping your hands steady enough to trim them, ask someone to do it for you. If you enjoy pedicures, only go to salons that are clean and hygienic. Take your own nail toolkit with you and ask them to put a tub liner in before soaking your feet. At each healthcare visit, have your healthcare provider look at any changes to your skin.
I asked my doctor specifically to check for any abnormalities in my skin because they have a tendency to hide in my freckles.
You may need to schedule a thorough skin exam with a dermatologist if needed. And at every healthcare appointment, take your shoes and socks off and make sure your doctor checks your feet. This is a good preventative step. But make sure to also schedule a complete foot exam once a year with your healthcare provider or podiatrist. During your yearly foot exam, your healthcare provider or podiatrist will check your feet for any circulation problems, deformities, damage, or changes to the shape of your foot. This appointment should include a monofilament test, which can identify if you have neuropathy. If you have developed neuropathy, or if there is damage or changes to your skin and feet, you may be at high risk for developing foot complications. Work with your healthcare team to develop a treatment plan to further reduce your risk and maintain your health. When you have diabetes, the smallest injury to your feet or skin can lead to serious health complications. But damage can be prevented. Remember to keep your blood glucose in a healthy target range. Protect your feet and skin in every situation. Check your feet and skin each day for damage. And see your healthcare provider and podiatrist regularly. If you do notice any changes in your skin and feet, especially breaks in the skin, sores, or redness, get treatment right away. So whether you end your day wearing those same old fluffy slippers or your dancing shoes, following these common sense steps can prevent serious health problems caused by diabetes.
The learning process is just never ending. I didn't really look at my feet care or the neuropathy aspects of things. Foot care and skin care is very, very important, and it's something that I am still learning about, especially if I'm going to keep running. You know, I kind of need my feet for that.
And the only thing you can do, don't let it control you, you control it. And this is what I'm trying to do, control it one day at a time.